As Patricia Seva said, I really am a student of the Faculty Center and of TLT. I came here a few years ago. I'm also very much supported by my staff in the Health Sciences Center, the Department of Physician Assistant Education. I came here as a clinician and basically jumped into a wonderful world of online teaching. As a healthcare professional, I'm a lifelong learner, as are many of us, as well as healthcare professionals. And I think that the world of healthcare training, professional training, has changed. So I'm going to show you a little bit about, hopefully.
I've lost control of the mouse. I can see it. Hold on, let me try one more thing here. Sorry.
I'll be able to show you a little bit about how I've incorporated several of the tools that were available to me through TLT. And the energy of which is not only mine, but certainly the individuals that have been in that department. Okay, so we've talked a lot about the incorporating technology into teaching material, and one of the challenges we face as teachers is to incorporate the development of a professional in terms of affect, or what is sometimes called metacognition, as well as cognitive skills. The how to teach enhanced communication skills in a virtual learning environment is the title of my talk. And rather than Kleenex, I think what, at least in the quote classroom, we've kind of redefined this and it's more broad, and I would like to say it's kind of morphed into a more valuable term we call reflection and narrative, where students are reflecting on what they've done and they're critiquing each other, and they're also using narrative. Oops. So, what do we find is most difficult in teaching professional behavior and how we develop professionals? Certainly, we've all had the experience of being in the doctor's office and realizing that they're really not listening to us at all. And having that effective communication is a skill that is not something that's certainly born in a professional, but certainly there's an interest in communication. And when communication doesn't work, it can be disastrous. There's certainly a fine line between developing this kind of emotional intelligence and being able to apply academic concepts to the learning of it. In the case of graduate professional training, this certainly is something that you can incorporate into your everyday life and everyday work and career. We talk about defining professionalism. We also talk about developing empathy. Some students don't really know that they have empathy or they can develop it, but certainly it's something that brought them to healthcare, whether they're a social worker or a physical therapist or a physician assistant or a nurse or a physician. The team interaction is very much a part of that, and of course career enhancement can result because of it. The more effectively we communicate in areas especially that are difficult to communicate in when we talk about terminal illness or end-of-life issues, the more skilled we are at using those tools and being able to communicate, the more respect we have and the more career enhancement potential we have. The setting is the workplace, but it can also be a clinical research area, a team-focused event. It can be a facility. It can also be a home setting. Wherever you have two or more individuals that engage in difficult discussions about life, about health, about choices, especially about the latter. This can certainly involve challenging populations of patients, whether they're young and whether they're old, whether they have mental capacity that's impaired or challenged, cultural differences, and certainly in this country we have multiple cultures that many of us don't understand, and having that awareness and integrity is very important. Certainly it was mentioned many times here that language is a difficult issue, or can be a difficult issue in teaching, and when you have students whose language English is a second language and they are professionals, that can become even more challenging when you're teaching them enhanced communication skills. The geographical differences are the challenges with a student geographically as well as with instructors. In the case of this particular course, I had multiple challenges. The students were in different locations as well as the instructors, different time zones. I think it was fortuitous that we all sort of understood that from the very beginning. So the plan really involved incorporating multiple types of formats. Of course, the first format is the learning system, Blackboard. But in this case, we also used a lot of case-based discussions with discussion board. We used a lot of case-based assessments with what you might call a quiz, but in fact, after the quiz was performed, they were done. And these were quizzes that were taken from national award examinations that were actually extracted for the purposes of the course. They were then reviewed by the instructors because the students were interested in knowing why they got them wrong. There was a whole library of tutorials that were incorporated into Blackboard through the Echo Center. And I have Jennifer Adams to thank for that because we had not only audio but video tutorials that were literally thousands of dollars worth of material that was incorporated into the course. It was accessible to all the students. And I haven't done the analytics yet, but I definitely will be doing that and seeing how much the students used it, because even in their reflections on the course, they applauded the use of them, and I know they did go into that center. We had multiple tutorials from different resources to help students understand how to do this. It doesn't just happen. And so we did incorporate that. And I used something that hasn't been mentioned yet, and that was Google Docs. This is a very interesting tool. We used it to collaborate on the course. The instructors, we had 3 other instructors besides myself, that makes 4. You might say, my gosh. And they were not here. They were all virtual. In fact, one of them I had not met before I started the course. But it was the most exciting adventure. And we all collaborated in Google Docs. We met in Adobe Connect. We collaborated in Google Docs. We developed the course, and then the students were able to use Google Docs, and they incorporated it. It's an asynchronous as well as a synchronous tool, so you can literally work together if you're in a document at the same time, and both see each other typing. This was very useful with the project that I'm going to demonstrate. And finally, of course, we used Adobe Connect, or SB Connect as we call it here. Not only did we use the pods extensively, but Google Docs were actually incorporated or brought into the dialogues, were brought into the scripts that the students formed, which I'll go into, were put into Adobe Connect. So there were 2 camera pods, so they were the team, so to speak. And they had the share pod, which had their script, and they had a chat pod, and of course I was there facilitating them. The recordings were then viewed by the students, by all the students. They all viewed each other's. So they had immediate feedback from each other and facilitators, namely all 4 instructors. So they had it was a tremendously rich experience for them, just this one project. And then, we talk about assessment. There are lots of rubrics around, but none really was very specific for what we call the case scenario rubric, which we developed. Was again with the use of the faculty center and specialist assessment. We argued back and forth amongst the instructors. We thought what should be put in there and what shouldn't be put in there. And in fact, that we came up with a tool which will again be fine-tuned, because as it goes, every time you use it, it becomes better. And finally, e-portfolio. E-portfolio is used in this campus at least by individual students to develop their career portfolio. In the case of this course, as you'll see, the portfolio was also a course portfolio. So each of the students had their own portfolios, and there was a course portfolio. which now becomes something that they will be able to access because they'll have other aspects of the course in there. In particular, I have the project that we're going to talk about. So this is the name of the course was The Clinical Aspects of Palliative Care. Palliative care is a new discipline that's being much talked about in healthcare. And in fact, this course became a totally interactive course. And it was very challenging because, believe it or not, it was a very rich course. And it took place over 6 weeks, 6 to 7 weeks in the summer. It was designed for clinicians of all types and levels. Most of the people who were interested in palliative care have some kind of experience with it. It was very unique because, as I said, the instructors as well as students were located in different parts of the country. And SB Connect was used extensively to collaborate, to assess the students, to debrief. In fact, when we had, all the presentations were synchronous. Most of the students attended, even though there were different parts of the world, different parts of the country, they were online, they were on call. Most of them attended. It was amazing. And they stayed after the presentation was done because that's when the instructors would kind of talk about the subject and what they had to do, and they kind of participated in the discussion. So it became sort of a discussion after the presentation, so it became a classroom, really. A virtual classroom. Of course, it was recorded, so those who were not there could see it and hear it, and then they gave comments. We also used extensively a discussion forum called Ask a Question, and that became a very active place where people would talk to each other in the course. These are just some of the comments of students. I didn't think I'd have time to play recordings, but from the actual Adobe Connect rooms. But they're just a few of the comments. As you see, they're very personal, they're very in-depth. These were very reflective, and they looked at each other's comments. You know, we always like student comments. I mean, in this case, the project made reflection and commentary that much more personal. The instructors all commented on the critiques that the students gave or their experiences in the room, and the comments were all shared. It was definitely a unique experience. But this student, so now the students. It was the first time the course was offered, and we had 8 students, and so it was a nice pairing up of 2 to each team. This student was actually able to incorporate many of the things that we did with this particular tool, which was enhancing communication skills, into her work. This student as well actually ended up getting another job that incorporated palliative care concepts and more techniques that he learned in the course into a new job. This person as well wanted to, she wanted very much to do a practicum or independent study on palliative care, but when she took the course and she realized that it was a much bigger project, but she was able to then go back to her supervising physician and say, we have something we can do together, and she developed a brochure actually. So this student as well incorporated work into his workplace. These 2 students, these are actually photos taken from the Adobe Connect sessions, so they're rather candid. I didn't want to show them all professionally except for the first 2. And this was kind of the setup where they could actually see each other in the rooms, and they could talk to each other, and they could see their emotions. And at the end, I think one of them did pull out a Kleenex because she got quite emotional about the script that they had rehearsed, and they actually changed the script because it became so involved. And they got so involved. And finally, this is from another group, 2 students who were also very challenged, and I'll show you why in a minute, in the same room. So just a word about the resources. As I mentioned, we had used Echo Center There's some YouTube videos that we incorporated, and these were bad news, how to deliver news badly, tutorials that we put in there for students to look at, and they did. And there were also some good ones, of course. And in the course portfolio, which I'll be able to show in the e-posters to you, I can show you some of the other ones. One unique feature of the course, which I wanted to just highlight, this course also incorporated pediatric aspects of palliative care. There's no continuing medical education conference or workshop that incorporates this as well. And I was fortunate to have instructors that were all expert in the field. One of them who specializes in pediatric oncology and palliative care. So her input was really extraordinary. So this is just a picture of the Google Doc, or part of it. The case scenario was given to each of the groups of students, a case scenario, and they divided up into dyads, if you will. And then they switched roles. So it was a role playing where one was a patient and the other was a provider. And then they had to write a script. Oh dear, I have 1 minute. Okay. They had to write a script, and then they had to write another script, and then they acted it. So just to tell you, of course, we always have challenges with Adobe Connect. This particular student, the one on the left, didn't have any sound. So she used a SharePod or a chatbot and typed out the entire dialogue. And you can probably even see the emotion on the other person's face, because this was very challenging to the provider. And then when they switched roles, she was the provider and the patient, and the other one was the patient. So, in fact, we were able to work through Adobe Connect with the SharePods. This is a picture of the rubric that we developed for this. This was very important to be utilized, and we all collaborated on it. And finally, the e-portfolio. So, in the e-portfolio, we put all of these things. And I invite you to come over to my poster, but I just want to tell you that this can be done. All of these tools can be used. Yes, they're challenging, and yes, they take a lot of energy, but the course can be very rich, very interactive. The students felt probably more that they got more out of it because it was online, because they had time to think about things and to react to each other. And then, of course, Adobe Connect is a virtual environment, a virtual classroom. We had office hours as well every week. So all of these things make the course richer, and it makes it certainly worthwhile for me. I very much enjoy teaching this course, and I look forward to doing it again. Thank you.